On any given day, about 3 million people fly on a commercial airline. That's about 45,000 flights in the U.S. alone.
Yeah, and with that many people flying every day in the U.S. and even more around the world, there's bound to be a medical emergency 30,000 feet up in the air. That's where a small group of people in a Phoenix hospital come into play, helping those sick passengers in the sky. 12 News journalist Justin Pazera has the story.
Tucked away at the end of a long, quiet hallway in one of the largest emergency rooms in the valley, a handful of people from MedLink sit in a small room and answer nonstop calls from commercial airlines.
I copy that. What is your emergency? Over.
Ahead with your passenger's age and gender. Over.
They're always in flight and can be anywhere in the world.
This is MedLink's physician. Do you copy?
The calls are for help. A passenger is sick thousands of feet in the air and possibly thousands of miles away from a hospital.
MedLink, this is Flight 729, a 50-year-old female passenger that lost consciousness, has no allergies, was unresponsive for a while.
A flight attendant calls MedLink and is patched through to Phoenix. The doctor is quickly figuring out how sick the patient is and if the pilot needs to divert.
And how long was she unresponsive for?
It's been probably 10 minutes.
Let's make sure this passenger is on oxygen.
It's very different than when we see patients in the emergency department where you can kind of touch and talk to the patient. Here, you're relying on someone else who may not be medically trained.
Monish Bao is one of the doctors who treats patients who are having a medical emergency in the air.
And we'll await those vitals. Thank you.
He says on any given day, this center in Phoenix at Banner University Medical Center takes about 300 calls.
Has he ever had any history of angina or myocardial infarction?
On this call, a passenger on an international flight is having chest pain.
Istanbul, we have a hospital that has excellent cardiac facilities.
There shouldn't be as long as she comes back to normal.
The team in Phoenix is quickly figuring out from a massive database of healthcare facilities around the world which one would be the best and closest to treat the patient.
The facilities in Dubai appear to be acceptable. They have what's called a cardiac catheterization lab, which would be the minimum requirement. So I'm fine with you going to Dubai if that's a better location for you.
If we're going to divert somebody, generally we like to get them on the ground as soon as possible, and so we're making a decision within 2 to 3 minutes that we need to get this passenger onto the ground.
Bao says only 1 to 2% of flights are diverted. Most of the time, it's a minor, treatable illness that can be handled with the medical kit on board every plane. All of the kits are color-coded to help the doctor on the ground direct a flight attendant in the air to what device or medication is needed.
If you need something for nausea, you do have a medication in your medical kit. Would you like me to spell that for you? Over.
The most common is probably somebody that gets up to go to the lavatory and passes out, and also people with GI distress, so vomiting, diarrhea, abdominal pain.
Across town, a different team is answering calls from crew members who are sick.
Very few people have any idea that any of this is necessary, much less available.
Dr. Justin Devlin helps this team with MedLink. He says they take anywhere between 10 to 20 new cases a day from flight attendants and pilots who are sick. The job here is to direct the crew to the closest and safest urgent care or hospital or determine if they are fit to fly.
What will happen to this person's medical condition? Will it get worse in the cabin environment as the plane takes off and cruises along, or will it not affect it?
The doctor says sometimes something minor on the ground can get serious 30,000 feet in the air.
For a blocked ear, gas expands, would cause a lot of pain, could cause perforation inside the ear. So that would be an example of a minor condition on the ground that could get exacerbated in flight.
If you're getting ready for a flight, doctors say make sure you have your medicine in your carry-on, not in your packed luggage. They say that happens frequently. And if you're not feeling well, don't hesitate to ask for help, because help is just a quick call away.
Have a safe flight. MedLink clear.
In Phoenix, Justin Pazera, 12 News.